Good morning, everyone, and welcome. We hope you all had a really great time last night and at our opening trade show, and at least a little time to enjoy beautiful New Orleans. If you haven't had time to enjoy New Orleans yet, I'm sure that you'll be able to work it in after, of course, all of the sessions, all of the things that we have planned. So I got to tell you, I'm pretty impressed and quite happy to see all of you here this morning. I didn't know if there'd be like 12 of us. You know, it's early, right? But wow, what a great group we are. Sandy and I were talking this morning, and I was telling her, I was telling my folks from Hawaii, it's really true. We are so fortunate to have the n4a staff, and with Sandy at the leadership, they have made a way for our network. We are so fortunate, and if you've been in any other realm of government or nonprofit with a national association, you know that n4a is exceptional. Wow. And just so you guys know, every single morning the n4a staff starts their day with a meeting at 7 a.m. Not 7:01, 7 a.m. So after you wake up in the morning, just remember that. They have been geared up, ready to go bright and early for us. So we're so appreciative, Sandy and your team. You are an incredible group of people. So thank you for your leadership and your dedication. So at yesterday's session, we tackled a big issue, which is how we frame aging. How do we champion for older adults and make sure that our language moves us forward or evolves to better reflect the full understanding of aging in older adults? We all know it's true, right? Aging is not like a, ugh. I liked how James last night, kind of went into that bucket, right? The woman on the video. Aging is exciting. We're all aging. And I'd rather be aging than not. How about you? I am going to do a cemetery tour Wednesday after the conference is over, and I'm glad I'm aging, right? It's exciting to age. So with that in mind, how do we, as a group, spread across the nation, how do we help move the aging network forward to meet both today's needs and to be ready for tomorrow's challenges? Well, by building on the pillars of our core work, what partnerships do we have to create now? It's about what each agency needs to do to meet their mission in changing times, but it's also about how we collectively build our capacity to address the aging of our entire nation. And getting there takes leadership. So the leadership, not only of Sandy and her team, but Sandy had us look around the room yesterday. We are all leaders. We are all leaders. And we have the opportunity to rise to that occasion every day. We also have incredible federal and national leaders. And they have a unique countrywide view. Sometimes we come in only with the view of our locality, but we also need individuals who have that nationwide perspective that helps move us all forward as a collective body. That's why we're really happy and thrilled today to be joined by our top federal aging leader, the Assistant Secretary on Aging, Lance Robertson, as well as a panel of experts to discuss the critical issues that make up Lance's 5 pillars. He's ready, but I'm not done, sorry. I'm not ready to leave yet. I still got a few things to say. I've been waiting 10 years. I have a little saying, I never met a Mike I didn't like. So if your name is Mike, I like you. But I'm quite at home with these mics too. But Lance is gonna remind us of those 5 pillars and the things that we all can do to help move the aging network forward. But before we get started and let the good times roll, as they say here in NOLA, we have to acknowledge the critical support of today's general session sponsor, Tivity. Tivity Health, please stand. This is Vicki and her team from Tivity. Tivity Health is a leading provider of health improvement, nutrition, fitness, and social engagement solutions at a scale to improve critical outcomes, to reduce healthcare costs, and to create opportunities just to feel better, to work better, and to live better. The company works hand in hand with members, clients, and healthcare partners to create everyday opportunities for long-lasting health and vitality. I'm in for that. Tivity's Health flagship brands include, listen to this list, Silver Sneakers, Nutrisystem, that's a new part of Tivity, how about that? Nutrisystem, Prime Fitness, and South Beach Diet. They're sought after not only because they work, but because Tivity Health is a trusted provider that holds itself socially responsible and accountable to the individuals and communities it serves. In addition to being a general session sponsor, Tivity has also been a tremendous supporter of n4a and its members, specifically those agencies in rural areas like mine. This year, 10 Tivity rural scholars received up to $1,000 each to attend this conference. That's incredible. And I see hands going up. Thank you. And it's great to see that when you invest money in our people, they're here at 8 a.m., right? That's a good investment. And it is an investment in the entire future of our network. I also want to recognize Tivity's help and sponsorship and support of the Aging Network family when good times weren't rolling. Last year, for the second year in a row, Tivity sponsored the n4a Disaster Relief Fund. Their $11,000 gift enabled 3 AAAs struck by hurricanes in North Carolina and in Florida to directly assist the recovery of older adults in those communities. So I would ask our friends from Tivity to rise again and be acknowledged for their exceptional support. Thank you so much. So in addition to those Tivity scholars, the n4a Building Our Capacity Fund, which you support through your annual dues and annual gifts, Tivity was able to provide we were able to provide conference scholarships for an additional 6 members this year. So our capacity fund contributes 2 scholarships as well. Any hands for the 6 additional scholarships? Or maybe you don't know what kind of scholarship you got. Oh, look, we got hands. Thank you for being here so early in the morning. We appreciate it. So that's a total of 16 people that were able to join us for this incredible conference. In addition to Tivity support for the 3 AAAs, the n4a Disaster Relief Fund, they helped 2 additional AAAs struck by floods and fires. So you can support our capacity building recovery work by buying, what do you think? Raffle tickets. Who's bought your raffle tickets? All right, cool. Now, I bought raffle tickets. I won't be able to be there. So I bought raffle tickets and just gave them away, right? So those lucky people that got my tickets, sorry, they're going to win something. Sorry for those of you who I gave the tickets to. But buy your raffle tickets. It really is a good cause. Our capacity building, our disaster relief fund, that help goes to support people amongst us as well as in the community. So even though New Orleans was largely spared by the severe devastation that Hurricane Barry wrought over other areas of Louisiana and Mississippi, other areas of Louisiana and Mississippi were not so lucky. Those AAAs experienced severe flooding in the aftermath of that storm. So, again, buy the raffle tickets. They're available out at the table. They're available in the booth at the exhibit hall. Your help really does make a difference in people's lives. So, with that, we're going to talk about the exciting possibilities and partnerships ahead for our aging network as a whole. To lead us through this discussion, as I said before, he's raring to go. We have with us the Assistant Secretary on Aging, Lance Robertson. Now, as you know, Lance holds two important positions. See, I'm just not going to give it up yet. No, he holds two important titles in the Trump administration. Not only is he the Assistant Secretary on Aging, he is also the administrator of the Administration for Community Living. He's been in D.C. now for a little over 2 years, about 2 years, and he's been serving as a champion for the work that this network does every day, fighting for greater visibility for the network with his federal counterparts, such as with CMS and HHS, and pushing for all of us to continue to innovate and grow. Prior to his federal service, Lance was a longtime leader in the aging and disability networks. He got his start in Oklahoma. I was waiting. I knew that would happen. Those women are wild. He served there for 10 years as the Director of Aging Services within the state's Department of Human Services. He also spent 12 years at Oklahoma State University, where he co-founded the Gerontology Institute and served as the Executive Director of the nation's largest regional gerontology association. We know that aging and caregiving issues and the work that we all do every day hold a special place in Lance's heart. We appreciate that this is the second time, Lance, you're joining us at the n4a Annual Conference and Tradeshow. So please, let's give a warm Hawaii welcome, and New Orleans welcome, and wherever you're from, welcome, to Lance Robertson. Thank you for being with us today.
Good morning, everyone. Thank you, Deb, for that very kind introduction. I also want to extend my appreciation to Sandy and to her team, to her board, and then certainly to so many who I know were involved in helping make this a great conference. New Orleans is such a fabulous destination. I'm glad to be here, and it's a real honor to be with all of you today. I brought with me about 24 colleagues from the Administration for Community Living, and I'd like to ask them to quickly stand. That was really intended to be a head count. We had a roster, and we were going to check. Now, these are outstanding professionals. I know a lot of them are familiar to you, and it's great to be here. We love being at events where we can actually have a face-to-face conversation. So during your time here, I would certainly invite you to visit with my colleagues about questions or issues, ideas you may have. So we have a very quick 15 minutes together for these remarks. So up on the screen is just a glimpse of what we're going to quickly talk about. I've got an announcement to share, as well as just a couple remarks around the reauthorization of the Older Americans Act. Most of our time I want to spend talking about opportunities. It's already been referenced by Deb. This is such an opportunity-rich time, I think, in the history of the Aging and Disability Networks, and we're going to talk a little bit about that and wrap up with opportunities and partnerships. One thing I want to do real quickly is introduce our new regional operations office, our staff, our team, and I want to do that by starting off and recognizing the newest member of our team, Dr. Tom Moran. Tom is going to stand wherever he's at. He's over here to my left. Dr. Moran. Dr. Moran is ACL's Deputy Administrator for Regional Operations and Partnership Development. Very glad to have Dr. Moran on our team. As all of you know, we now are going to have at ACL a regional administrator in each of the 10 Health and Human Service regional offices. And I'm happy to share with you today the people that we have selected for those roles. So on the screen now you will see the individuals who we have selected, and many of them are, of course, familiar to you. I wish I had time to introduce each of them, but I'm sure you will agree with me that they will do an outstanding job. Region 9, by the way, I do want to point out, David Ashita is retiring next month, so we're searching for a Region 9 administrator, and in the interim, Percy Devine will fill that role and will be assisted by Shelley Zylstra, as you see on the screen there. Many of these folks, of course, are here in New Orleans with us, and you'll have a chance to actually talk to them as a group in the session tomorrow that is titled the ACL Regional Administrators Listening Session. I want to give a plug for that. That is happening tomorrow morning at 10:15 in the St. James Ballroom. Please join us. We'd love to shake your hand. So let me quickly then dive in. I want to talk about the reauthorization. Again, I think that Amy has done and will continue to do an outstanding job of sharing information and collecting your feedback, and then, of course, translating that input to the Hill. As we all know, the act expires in September. Of course, I can't share any of the specific details of what's being discussed. That would be the last time I could talk to all of you. So those details, as they are being finalized and worked out, I promise you are exciting. What I do want to stress, though, around the reauthorization, consistent with what you've been hearing me say, is how critically important it is that you be involved. You are the boots on the ground, and it is so important that Congress really understands what you do and the impact of your work. The stories of the real people you serve are so powerful, and I want to encourage you to make sure that those stories are heard. And along with those stories, be sure to share what are your needs to continue to serve those older Americans. And then finally, as a reminder, the advocacy work and the storytelling you do does not need to happen just around reauthorization time. It needs to be happening every day. Every day. So now let's pivot and talk about opportunities. I'm really excited to share with you, I think, a very powerful segment of this presentation. And as you've heard me say before, a big part of my job, and candidly a big part of everyone's job in this room, is to be a salesman. It's up to us to make sure that all the people who make the decisions about our programs know the difference that these programs make, and that they understand the importance of the expertise our network brings to the table. That's always been important, but it's never been more important than now. So let me tell you a quick story. Once upon a time, long before smart homes, smartphones, and even cell phones, Americans spent a lot of its free time entertained by these. For those of you who weren't born in the 70s and 80s, this is a VHS tape. How many of you still have VHS tapes? Don't lie. A moment of honesty. Very good. Videotapes made it possible for everyone to enjoy the greatest that Hollywood had to offer in their own homes. By the mid-'80s, video rental stores were everywhere, and business was good. There was room for the mom-and-pop stores as well as the chains. About that time, Blockbuster Video was just starting out. By using a proven model of expansion coined by a guy named Ray Kroc, who we all know is affiliated with McDonald's, they quickly became a multi-billion-dollar company. They were in every community, and they were the best at what they did. They had a great service that everyone wanted, and they executed it well. In the late 90s, DVDs started to take over. Those took up less space, and that gave Blockbuster some new competition. They also could be mailed pretty easily, which would turn out to be important. But if DVDs were disruptive, the 90s also carried the seeds of revolution for home entertainment. The internet quickly became mainstream. And thereafter, broadband came on the scene, and all of that change in the home entertainment industry created some real opportunities, and it was exciting. A little company named Netflix started offering customers DVDs by mail. Netflix subscribers in the room? Yeah, absolutely. For a few bucks a month, you could keep 3 movies at a time for as long as you wanted. Now, you may not realize this, but Blockbuster actually made a sizable percentage of their income on late fees. Another show of hands. Guilty as charged? Yeah? People always seem to return those movies late, and Netflix took aim at that. Videos on demand also started to become a thing. Those early days were an important time and a fast-changing time. Companies needed to pay attention, recognize what was happening, and move quickly to adapt to a changing world. In 2000, Blockbuster had an opportunity to do that. Netflix offered to sell themselves to Blockbuster for the small amount of $50 million. Netflix proposed to handle the online business while Blockbuster would take care of the DVD logistics, all under the Blockbuster brand. At that point, Blockbuster's business had declined from its peak, but they were still doing very well. And they did not believe that Netflix or any emerging service was a threat to their bricks, mortar, and late fee model. They said no. And actually, if business lore is accurate, they all but laughed them out of the room. It wasn't long, though, before Blockbuster realized the error of its thinking. Just a couple of years later, they entered both the mail order and the streaming business, but it was too late. They couldn't compete with what had grown while they were still holding tight to the old model, partly because members of the leadership structure still weren't ready to make the move. And of course, the rest is history. Blockbuster went bankrupt in 2010, and today Netflix is number 38 on Forbes magazine's list of the world's most valuable brands. So folks, we are the Blockbuster of 1999. But let me explain. Let me unpack that for you. We are in every community. We have unmatched expertise at what we do. And where Blockbuster had something that pretty much everyone wanted, what we do meets, no kidding, critical needs. But as was the case for Blockbuster, the world we operate in is changing, and it's changing fast. When I spoke to you last year, we were excited because this opportunity really was just taking off. It was about that time, you'll recall, that Secretary Azar, my boss, started talking about the need to integrate the home and community-based services, which of course we all know help people live longer, healthier, and more independent lives, into healthcare. A year ago, we were starting to see a recognition across the department of our program's prevention role and how pivotal it was to Secretary Azar's top priority of transforming healthcare to a value-based system. As he has said, a system that pays for value will aim to move patients into the lowest cost, most appropriate setting. And that means avoiding hospitalization and nursing home admissions, shortening stays when they occur, and preventing readmission. Today, that spark of recognition has grown into broad agreement on the importance of addressing social determinants of health if we want to improve health outcomes and reduce costs, especially for complex populations. Addressing the social determinants of health, as we all know, has been our bread and butter. That shift in thinking at HHS, however, is translating into policy and action. For example, the expansion of flexibility in supplemental benefits for Medicare Advantage beneficiaries is a sea change. Not only does this mark the first time Medicare has paid for services that are not primarily health-related, but it also allows for services to be individually focused. In general, all payers want to address the major drivers of healthcare utilization, cost, and quality, and they are starting to understand the results they'll achieve with programs and services that prevent falls, address food insecurity and transportation issues, manage chronic disease, reduce social isolation, and otherwise address the things that are not necessarily about healthcare, but which have a tremendous impact on health. So we have an unprecedented opportunity. We can meet these needs better than anyone. We already have the ability to leverage the reach that we have into the home, and not only to do meal delivery, but at the same time assess risks of falls and identify for other interventions before they reach the crisis level. It's that reach into the home and our knowledge of how to work with the person that determines their needs as defined by them that makes the difference for our network. We have to be part of the healthcare delivery conversation. What we need to be able to do across our network is package and price these services and make them easily purchasable for healthcare organizations. We know that there are already a number of contracts out there between community-based organizations and healthcare entities in our network, and that is outstanding and exciting. But we are now at the point where we have to expand our capacity across the board. Blockbuster lost money by not evolving. We stand to lose that too. Think about it. The Older Americans Act brings $1.8 billion into funding our network. Compare that to about $1.6 trillion that's possible through healthcare payers. And these new revenue streams are important for our ability to meet growing needs while government funding remains flat at best. But we also stand to lose much more. If we don't move quickly and effectively to take advantage of these opportunities and partner with healthcare organizations, they will build their own systems to do what we do. That's already happening. Healthcare plans are creating, in some instances, what they're calling non-medical navigators. And they will not, though, have our expertise, nor will they have the passion for the mission. And also, they will cause us to be in a position as a network where we're using scarce resources to duplicate efforts, which means ultimately serving fewer people and not being able to serve them as well as they need to be served. So again, we are now at a critical juncture. As a network, we are only as strong as our weakest link. If a payer has a poor experience with one of us, they're not likely to be inclined to give our network another shot. Last year I talked to you about mentorship, and I encouraged you both to find one and to be one. And I can't stress that enough. If you're one of the AAAs that's figured this out, we need you to help your colleagues who are struggling. If you're one of the AAAs who is struggling with this, I challenge you to use your time here to find one of those mentors. And we know there are real issues that make this tough, and I don't mean to minimize them, but we have to work together to overcome them. We know one of these challenges can be the perceptions of conflicts of interest. The Older Americans Act draft the reauthorization draft does include language that would clarify some of the confusion about what the statute allows. Also, in the very near future at ACL, we're going to be awarding a contract to define the roles of the states in the business acumen work we've been doing. And then also we're tackling issues around the SHIP program. We know that SHIP counselors, any SHIP counselors in the room? All right, very good. We know that SHIP counselors have to maintain their neutrality, but the network also needs to be able to partner with healthcare organizations. So we're putting together a working group to come up with recommendations on how we can make that possible. Another challenge is that the healthcare model is different. Healthcare organizations want a single point of accountability, and they don't want to contract with a lot of separate CBOs. And they're often organized geographically. So one model is to build CBO networks that can offer that single contact point and which align with the footprint of their health plan partners. And that's exactly what we're starting to see happen in states like California, Indiana, Texas, Pennsylvania, Ohio, and more. And that is one way to simplify our offerings to payers. It also offers a way to build our capacity. We know everyone is not in the same place, however. Some AAAs are already leading networks. Others are ready to be. Many others are not there, but yet they're ready to serve as a service provider in the network led by another AAA. This model gives us a way to harness and grow each agency's capability, and it also gives the AAAs an on-ramp. So that's one promising practice, and again, there are others, but we're looking for opportunities to foster that development. So a quick poll. Which describes your agency? Raise your hand if you have contracts with healthcare organizations, or you're close, or maybe you're even leading a network in contracting with healthcare organizations. Outstanding. Outstanding. Now you're going to have to find a colleague to adopt and mentor. We baited you. And if you're not ready, I challenge you to look for opportunities to partner with your colleagues here, as well as other CBOs who aren't traditionally considered part of the aging network. And if you don't have your hands raised, again, you need to be finding the person that just raised their hand. Now, secondly, raise your hand if you're ready but need help. Maybe you could get there as a partner in a larger network or with some mentoring. And again, you have colleagues who we know are here to help you. Raise your hands if you're in that second category, please. Okay? All right, so again, what we want to make sure across the full network is that we don't encounter this third category. So don't raise your hand. No blockbusters in the room? Very good. Again, that was a trick question, but if you're not ready, if you are not in the middle of these conversations today, then you face this risk. We face this risk. As I mentioned, we're only the strongest as a network that we can be when we are all doing this work together. So while we're seeing an unprecedented openness to bringing human services and healthcare together, we need to continue that momentum and solidify the progress that we have made. A significant focus for us at ACL is finding opportunities with leadership across HHS to advance our message and mission. I'll tell you very quickly about a couple of those examples in closing. In March, we brought in some of our network innovators to brief the HHS Deputy Secretary, Chief Operating Officer of a $1.6 trillion federal agency, and to showcase the incredible work of our network. That had a huge impact. And since that meeting, we've been answering a lot of questions, and we've been part of a lot of discussions that used to not happen with us. One great example is the expansion, as I referenced earlier, of the Medicare Advantage supplemental benefits. ACL worked closely with CMS in putting out that guidance. And a year ago, candidly, we probably wouldn't have been invited to be at the table. So we're meeting regularly with CMS on HCBS policies, as well as trying to get ACL, and by extension, all of you, a seat at the table for more of those critical discussions. This is a quick snapshot that you'll see up here of some of the different touch point work that we do with CMS. Often I've been asked, are you working closely with CMS? Are you building a relationship with CMS? Take a look behind me. That gives you a very vivid example of how significantly we at ACL are leaning in to the CMS relationship. Each bullet represents one significant part of the conversation we're having with a component at CMS. So similarly, we're working again to increase the visibility of the work that we do and the value that we can bring all of us together to the federal government. So I'm challenging all of us to really step up our game. We have a window of opportunity, but it's going to close fast. I'm challenging you to accelerate the work you are doing to evolve your business processes now so that we're able to support the transformation that is happening in healthcare. We are looking for ways to better support you as you build that capacity, and we're also investing heavily at ACL in sustaining the momentum that has been building and increasing the recognition of the value that we bring. It's a little bit scary and it's going to be a bit bumpy for some, but ultimately, this is what will make it possible for all of us to continue to serve older adults and people with disabilities and to make community living possible for more people. It's an absolute honor to be here today and to walk alongside you in making the vision a reality for all Americans. Thank you very much. All right. Autumn said we have a few minutes for questions, and I believe there are mic runners in the room. Anything I can answer for you at the moment? Donna Harvey, for those that don't know Donna Harvey.
So Lance, what keeps you up most at night in that litany of things to do that we can tackle today?
Thank you, Donna. I think that honestly, and again, I hope it was clear in this message, it is that sense of urgency. Like all of us who have been in the network years and in some cases decades, some of these conversations have sort of petered along. Honestly, as I've made clear, the window is closing. I think that we have a very limited amount of time to sort of pull this all together, to create the models that we need to be able to sell and to be a bigger, more significant part of the healthcare conversation. Candidly, I believe that it is critical for the sustainability of our network. Thank you, Donna. Got one in the back of the room. If you'll introduce yourself, sir.
Hi, my name is David Kelly from Vancouver, Washington, the AAA in Southwest Washington. So who's Netflix? So if you say that we have a potential of being Blockbuster, who is Netflix?
Yeah, thank you, Mr. Kelly, for allowing me to clarify that. So the analogy, of course, I hope that is clear, is that for those that choose to stay on a path of tradition that is now some 50 years old, you run a risk of being the Blockbuster. I would say that by show of hands, a number of you in this room, you are the Netflix. You are folks that have innovated, you are innovating, and I think the call here this morning was to make sure we're all on the Netflix bus, not the Blockbuster bus. So again, thank you for clarifying, Mr. Kelly, and thanks for the work that you do in Washington. One more question?
Hi, I'm Holly Rhodes-Teague from Suffolk County, New York. The question I have, I think I've heard that around the country it's the same issue, that there are not enough workers to provide the home care that's necessary, and I'm wondering on the federal level if there's any initiatives going on to help address that.
That's a wonderful question, certainly pertinent. We're talking about workforce. How can we make sure that we have the appropriate number of workers, that they're well trained, they're ready to fulfill these roles? Again, in the private sector, they're calling them non-medical navigators. I think the reality is there's an urgency around that conversation too, and certainly at the federal government level. Within HHS, we have HRSA and several other fellow sister operating divisions who are making this workforce conversation a top priority. And I can tell you at ACL it is for us as well. We don't necessarily have all the answers, but our commitment is to walk alongside you to make sure that we build the workforce of tomorrow that we need to be successful. So again, thank you so much for your question. Autumn, I think we're done. Oh, hey, here's Deb. Welcome, Deb, back to the mic.
Thank you, Lance, for setting your vision out so clearly and for understanding the critical role that AAA's and Title VI agencies play in the future of the network. We appreciate your leadership and the opportunity to have these conversations with you both here at our conference and year-round. So, he's not done yet, though. Today we're going to have a panel. He'll be joined on stage by a panel of experts representing each one of the pillars of Lance's administration. So, first off, our friend and fearless leader, n4a CEO Sandy Markwood. She will focus on ACL's first pillar, connecting people to resources. Sandy has led N4A for nearly 20 years, and at the heart of that leadership, the goal of N4A and the Aging Network remains to ensure that older adults and caregivers have access to the resources they need to age with dignity and independence at home and in the community. We couldn't think of a better person to represent this key pillar during today's conversation. Many, if not all of you, know the next panelist, Bob Blancato, president of Matz, Blancato and Associates. Bob wears many hats in the aging community, including as the national coordinator of the bipartisan 3,000-member Elder Justice Coalition. While we know Bob has much to say about many issues, today he will focus on ACL's second pillar, protecting the rights and preventing abuse of older adults. We appreciate that in today's economic landscape, ACL's third pillar is expanding employment opportunities for both older adults and people with disabilities. This is a challenging topic that deeply resonates with all of us here, and we're pleased to welcome Robert Espinoza, Vice President of Policy at PHI, where he directs a national policy advocacy and research program that is focused on the direct care workforce. Robert is nationally recognized as an expert in aging, caregiving, and long-term care workforce issues. So the last question was perfect to bring Robert onto the stage, and we welcome him here with us today. We also welcome Grace Whiting, who is the President and Chief Executive Officer of the National Alliance for Caregiving. Grace is a nationally recognized expert in the issues of caregiving research and caregiver support, and will be discussing ACL's pillar to support families and caregivers. And last but certainly not least, our very own Marisa Scala-Foley, N4a's very own. Another hopefully familiar face for many of you, and Marisa will focus on the final and vital pillar to strengthen the aging and disability networks so that we all can continue to support overall efforts to improve health and wellness and to help older adults and people with disabilities live independently in their community. Marisa joined N4a last year as the director of the Aging and Disability Business Institute, which provides community-based organizations with the tools and resources that we all need to successfully adapt to a changing healthcare environment and to capitalize on emerging opportunities to diversify funding. Prior to her current role, Marisa also served at ACL. With that, I'll turn it back over to Lance to get us started with our panel discussion.
All right, thanks so much, Deb. Have the privilege, of course, of being joined on stage now by 5 outstanding leaders who are going to make my job easy as we talk about some of the work that the network is doing around the 5 pillars that you've heard us talk about. And as a reminder, these are key areas of focus that are critically important across both the aging and disability networks. These 5 are unifying issues, they're understandable and relatable, and they help amplify the work that we do in a way that can really be seen as moving the needle. I know many of you are familiar with these, so I won't spend much time on them, but for posterity's sake, let me quickly run through what we're talking about with each of these pillars. And I'll start with the first one with Sandy. The first one is connecting people to resources. When I've talked to people we serve, one of the biggest concerns that I've heard is the need for information. More than anything, if we can empower individuals and families with good information at the right time, with person-centered connections, then we enable them to provide the care that is needed to remain in the community longer. So our commitment at ACL is to do a better job and really build upon the innovative ways the aging and disability networks are getting information and assistance across to individuals in need in a more timely and relevant way. And if we can do that, then I think we'll have accomplished some incredibly good things. The second pillar is about protecting rights and preventing abuse. All people, I believe, and you too, I'm sure, have the right to live their lives with dignity and respect, free from abuse of any kind. Unfortunately, far too many fellow Americans wake up in the morning and wonder if they're going to be abused, neglected, or exploited. And at ACL, we remain committed to developing systems and programs that prevent abuse from happening, protect people from being in abusive situations, and support them when they experience such abuse. The third pillar is about expanding employment opportunities, particularly for older adults and people with disabilities. At ACL, we have a vibrant workforce that benefits from the diversity and experiences of people from all backgrounds. That includes many people with all types of disabilities, and it also includes people of multiple generations. Matter of fact, at ACL, we have a contract employee who is 91 years old. And I hope that your employee pool likewise celebrates such diversity. And we're working with our partners across the federal government, with states and communities, and with older adults and people with disabilities to remove barriers to employment. And we're very glad that Robert is here, who is also going to talk about another critical piece of the employment issue, and that's the direct care workforce. The fourth pillar is supporting families and caregivers. Without family caregivers, we simply couldn't support people in achieving independence and living at home and in the community where they want to be. Supporting them is at the core of ACL's mission, and we have a number of programs and initiatives that do just that. which of course you know well because many of you make them possible. We also are actively seeking to develop partnerships with others whose work involves family support and caregiving across the entire lifespan. Let me talk just a minute about the RAISE Act and the Supporting Grandparents Raising Grandchildren Act. Each of these laws establishes an advisory committee made up of federal and non-federal members. We haven't officially announced this yet, although that is imminent, because we're still nailing down the final details, but we are planning the first meeting of these two advisory committees for the very end of August. It has been like birthing a pachyderm. So watch your ACL updates for more information. Finally, the last pillar is strengthening our networks. As you've heard me talk about earlier, the Aging and Disability Networks are uniquely positioned to support overall efforts to improve health and wellness for Americans and to help older adults and people with disabilities live independently and in their communities. We have a real opportunity to play a positive and powerful role in the road ahead. So again, with that, a quick overview of the 5 pillars. And now I understand each of our wonderful, distinguished 5 panelists are going to give kind of some opening remarks, followed by some questions that I've got. And then if time allows, we'll have questions from the audience. So thanks so much again for your support of the 5 pillars. It really is building a great and momentous conversation on the Hill and in DC. And with that, I want to kick it over to Sandy.
Great. Lance, thanks so much. And thank you for your leadership and how you've defined the pillars. When I look at the pillar on access and connection, it's what the Aging Network does. It's core to everything that all of the services, the way that we've structured ourselves, and the work that you do collectively as I look at this audience every day. I would like to look, though, at access and connection in 3 different ways, because I want to broaden that out as we think about this issue. First, I look at access as connecting people to those community resources. And that is a core and critical element of what the information referral, information assistance programs do in area agencies on aging and Title VI programs every day. And n4a is so privileged to be able to operate the elder care locator for the Administration on Aging, for ACL, to ensure that people who don't know who you are can connect to you. And in saying that, what we see through the elder care locator, and we know that it's been echoed that you're seeing at the local level, is the #1 issue people are calling about is access to transportation. Second issue is accessing home and community-based services, the services that you do every day. Third is accessing health care. And a growing issue that we're seeing is elder abuse, combating elder abuse. So this is really the pulse point that we have on what the issues are of an engaging older population and their caregivers and how we respond to that. In looking at that, what we've heard is not only with the increasing aging population are we getting more calls, but those calls are more intense, they're more complex. People have not one need, but multiple needs. So that is really a challenge that we're all facing. But as we look at access and connection, another bucket that I would like to look at it in is really looking at the issue of connection to community. Because as we age, and we saw the reframing discussion yesterday, is we want to ensure that older adults can be a part of their community. And in saying that, as I said, transportation is the critical issue that people are calling about, and you can't be connected to your community. You can't even get connected to your services if we don't have adequate transportation, which is why n4a is so pleased to be working with Easter Seals on the National Aging and Disability Transportation Center to look at innovative ways to do that. Additionally, also, we know that 70% of the Aging Network is also looking at developing planning practices and tools to create livable communities for all ages, age-friendly communities, dementia-friendly communities, and that's another way. It's critical as we look at connection and access. And finally, I think another issue that's been raised already in the conference is the issue of access and sensitivity to the diverse elders that we are and will be serving in the future. When we look at the percentage of minority elders in this country by 2050, it will increase by 200%. So it is very imperative for the Aging Network to be prepared and to be sensitive and to be able to respond to the needs of our increasing diverse elder population, and to celebrate that as we look at ways that we do both provide access to our services, but also the ways that we deliver them.
Excellent, very good. All right, thank you, Sandy. Bob?
Thank you, Lance. Good morning. It's great to be back at N4A. As Lance and a lot of people know, last week was a very good week for Elder Justice Front. An important hearing was held in the Senate Finance Committee to start the process for what was expected to be a new version of the Elder Justice Act. I was proud to testify on behalf of our coalition, of which N4A has been a long-time key member. And it was a very strong turnout of senators, which suggests to me that this bill has possible action for later this year. The 5 cores of the Elder Justice Act will be carried into the new bill: dedicated funding for adult protective services, enhanced training and support for long-term care ombudsmen, grants for elder abuse forensic centers, continuing the Elder Justice Coordinating Council, and establishing a new advisory board on elder abuse. The rest of the bill will be around nursing home reforms, which are needed, including informing Nursing Home Compare, more prompt reporting of crimes, and tied to conditions of participation, and stronger criminal background check provisions to keep bad people out of nursing homes. But my focus is on the elder justice pillar, and I commend Lance and ACL for keeping elder justice work as a priority. 3 things stand out from the protecting rights and preventing abuse pillar. First is the commitment to support and strengthen existing state and local APS systems with the necessary focus on consistency in policies and practices of APS across the country. ACL's adoption of guidelines from NAPSA was a very important development in that work. Second is the progress being made to address one of the 8 gaping deficiencies we have in the field of elder abuse prevention, that is data. In our world, data drives dollars. If you have it, you stand a chance for good money. If you don't, you're in tough shape. While a different kind of data was raised at our hearing, but it raises the point very clearly. At the hearing last week, a person from the Office of Inspector General said that CMS needs to use Medicare claims data to investigate abuse and neglect. And the quote was, "Data forms the bedrock of oversight. Medicare beneficiaries are at a high risk of neglect. Medicare claims data is a powerful tool to fight against neglect," unquote. So data is very important. A third important part of the pillar is the work to advance concepts like supported decision-making as an alternative to guardianship. This is a potential big new area in the focus of elder abuse and elder justice. It is seen as a state issue, but as more abuses get reported, this can lead to new federal legislation. Supported decision-making is an important concept that should be looked at. But while not directly in the pillar, but worthy of note has been the tremendous work being done by the Elder Justice Coordinating Council, chaired by Lance. They got a pretty good endorsement at the hearing, Lance. It was the only question I got was on the EJCC and how we should continue it. And one of the more foresighted elements of the Elder Justice Act was to create the Elder Justice Coordinating Council. The premise was there are numerous federal agencies doing some work in elder abuse prevention, but they're not connected or coordinated, which is counterproductive in this environment. Today, under Lance's leadership, the dozen or so agencies in the EJCC are working collaboratively on the many facets of elder abuse. Most prime example is the work to crack down on robocalls. By the way, audience question, how many people in this room got a robocall in the last 3 days? Raise your hand. Okay, see why this work is important, right, going forward. And then finally, on the opioid issue. There is a growing tie to elder abuse and opioid abuse, something which I, on behalf of the coalition, first raised before Congress in 2018. We conducted focus groups in 4 states, and the conclusion was a double-digit % increase in reported cases of elder abuse tied to opioid misuse. We joined with Lance earlier this year to meet with Admiral Brett Gerard, the HHS official most responsible for coordinating response and resources on opioids in HHS. And then we also note in the House Appropriations Bill there is language that says an additional $2 million is provided for additional screening for elder abuse, neglect, and exploitation. The committee recognizes the opioid crisis is affecting adult protective services, especially with respect to clients who have been victimized by those using opioids, and believes this work can be part of the increased screening effort. The protecting rights and preventing elder abuse pillar ties directly to the Aging Network day-to-day work, because elder abuse is a problem that affects everyone in the Aging Network. The pillar should result in closer working ties between the Aging Network and adult protective services so more detection and reporting can happen. Examples are such as the 5 resource centers that are being operated by ACL, and they are all important to work in elder abuse prevention. and the close to 40 grants that have been given out by ECL to enhance APS systems. So I'll stop there. There's a couple of things we'll touch on later on, but thank you very much.
Awesome. Thank you, Bob. Very good. All right, Robert.
Thank you, Lance, and thank you, my fellow panelists. Good morning. For those of you who don't know me, I'm Robert Espinoza, and I work with PHI, formerly the Paraprofessional Healthcare Institutes. I'm going to be focusing my remarks in two areas. One, the importance of the direct care workforce in supporting older people in all parts of the country, and two, the importance of creating employment opportunities for older people around the country. For those of you who don't know, the direct care workforce includes about 4.4 million home care workers and nursing assistants around the country. They are considered often the paid front line of care, and they support older people and people with disabilities with critical daily support such as dressing, bathing, eating, and much more. For home health aides and for nursing assistants, they also provide clinical support such as medication management. For family caregivers, they provide critical respite and support. And for the economy, they also boost jobs and they boost the economy. Home care jobs in particular are the largest growing job occupation in the country. Unfortunately, these jobs are too often characterized by low compensation, by minimal training opportunities, by limited career advancement paths. Too often, turnover hovers around 60%, if not higher, often within the first 90 days. The annual cost of turnover is about $2,500 per worker, and it leaves many states and many providers stranded without the supports that they need. There is a growing recruitment and retention crisis that is creating about 7.8 million direct care job openings by 2026. This calls for attention in strengthening this workforce and ensuring that all of us can receive paid support. And I'd like to point out three things that the Aging Network can play a role in. The first is in raising awareness about the workforce shortage, particularly in home care, and raising awareness among policymakers, among industry leaders, among the public at large. The second is the importance in advocating for more funding, both OA funding and also Medicaid and other public funding that could help boost job improvements and support older people and people with disabilities. And third, the importance of training more older people as direct care workers. Our research, and I want to shift a bit, shows that 1 in 4 direct care workers is aged 55 and older. All around the country, 848,000 people aged 55 and older served as direct care workers, contrary to the myth that this job is too physically or psychologically demanding for older people. Oftentimes, our research shows that older people bring significant caregiving experience with their children, with their spouses, with their own parents. They bring decades worth of professional skills and expertise, and they are often looking for second, even third careers that can be really rewarding. And they are not just central to direct care, they are central to the American workforce. In January of this year, research showed that workers over age 55 filled nearly half of new jobs created in 2018, and that they are healthier and better educated than older people in the past. Unfortunately, the research shows that too often ageism and bias prevents older people from participating in all kinds of industries. It hurts them in terms of hiring, promotion, performance, and ultimately employment. It comes at the worst possible time when older people are most financially insecure. So an opportunity for us as a sector is to think not just about strengthening the direct care workforce, but about creating employment opportunities for older people, challenging the myths head on, and creating incentives that break down those age-related barriers. The final point I want to make is that we are also living in a country that has become increasingly diverse and will do so in the decades ahead. It's not just growing numbers of older people or growing numbers of people with disabilities. It is also people of different races and ethnicities, cultures, and languages. We are seeing the first generation of LGBT people aging openly. We are seeing immigrants enriching our communities and our workforce, bringing much wisdom to medicine and science and healthcare. Unfortunately, we are also seeing disparities, and we are seeing too often women, people of color, LGBT people, and of course, older people and people with disabilities denied job opportunities in the public sector and in the private sector. So a final opportunity for us is to think about how do we diversify our own leadership from the top down to reflect that changing society. Thank you.
All right, thank you, Robert. Thank you so much. Grace, hi, good morning. Thanks for being here.
Hi, Lance. Thank you for having me, for your leadership. And Sandy, thank you so much for just what you do for this network. I have to brag, Sandy is also on our board of directors. So if I do anything off color, just don't tell her. Just But I'm Grace. I'm the president and CEO of the National Alliance for Caregiving, and it's an honor to be here with all of you. I'm actually a proud graduate of Louisiana State University, and spent my formative, go Tigers for anybody out there, but spent much of my life in Louisiana and in South Mississippi, so very excited to be home again. I have to tell you guys, Thursday, my parents are very traditional baby boomers, and they live in Texas now, in Austin, Texas. So Thursday afternoon, I get this text message from my dad, and it's like, "Hi, Grace, your mom's in the ER, septic knee, question mark?" And I'm like, "What is this?" And I call my dad, and I'm like, "Dad, what's going on?" And he's like, "Your mom's in the ER." And I said, "Well, do you need me or my sister to come down there?" And he's like, No, we're fine. Don't worry about it." And I'm thinking to myself, this is, these are the type of patients that would, their arm would be falling off, and they're like, "It's okay. Don't worry your head about it." So I call my sister, and we confer, and we decide our parents are crazy, and we're going to go down to Austin anyways. So I get to Austin, it's like 11 o'clock on Thursday, and I walk into the ER, and we didn't tell them that they were coming because they don't want to feel like they're imposing on us. So I come into the clinical decision unit, and I peek my head around the corner, and I'm like, "Hi, Mom." And my mom went totally white, and she told me that she thought that she was dying and I was an apparition that had appeared, which I feel like was a very subtle way of her telling me to visit more often, to be honest. But so, we're sitting there, and I tell her, my sister's going to come in the next day, and we just wanted to check in, and then we knew Dad had to work on Friday, and so that way we could be with her, and I had a car in case she needed to be discharged before my dad was up. And anyways, the nurse comes in and takes her blood pressure, and nurse goes, "Miss Juno, your blood pressure is very high." And she said, "Yeah, my daughter's here, and my other daughter is coming, and we're gonna go party, and I wanna get out of here." So, and I share that for a couple reasons. One is, I'm very lucky. I have a fabulous team back in Washington. You may know Mike Whitkey, who's our Senior Director of Public Policy and Advocacy, and he works with a lot of folks around the country. And I felt comfortable leaving my team. I'm also, to some degree my own boss, so I didn't have to ask for permission. I could just go. But many, many, many Americans are not in that same situation. And when we look at what's happening in caregiving, we think about it as being this personal experience, but it's really a public health issue. We estimate in our work with the AARP that there are 44 million Americans who are caring for a friend or a family member who has a disability or a health care need. And if you took every one of those people and you replaced them with a direct care worker, it would cost our economy $470 billion a year. I mean, we're talking about a country almost as big as the entire population of Argentina that is a volunteer workforce and the backbone of our health and long-term care systems. And I raise that because when we look at that, we also say to ourselves in Washington, how do we build this network, this momentum in caregiving into a movement? And we see three solutions: research, advocacy, and innovation. Now, on the research factor, there's not a consensus yet on how many people are caregivers and really what that looks like. So I've seen estimates as low as 17.5 million people who are caregivers, all the way up to 90 million. Now just imagine you go to Congress, you sit down with your favorite, most handsome congressman, and you say, "Oh gosh, this is a big issue. We need to do something to support these families." And they say, "You know what, you're right. How many people does it affect?" And you say, "It's somewhere between 17.7 and 90 million Americans." So what I would say to all of you is research. We need research on caregiving, and that's part of what we're going to see under the Raise Family Caregivers Act is identifying what those research questions might be. And we need that research to be across the lifespan and to acknowledge that when you are caring for someone, you are also aging, and that it's not just a situation that happens right when we turn 50 or 60 or 65. The second piece is advocacy. Understanding that family caregivers are unique human beings. We see this all the time on the biomedical side. People will say, when I say patient, I mean caregiver. Well, they're two separate entities, even though we often don't think of them that way. And we know from our global colleagues that caregivers need rights. They need the ability to take time off of work to care for somebody, to protect their job if they need to re-enter, to be able to manage their own health and wellness. And that's, I think, where the Older Americans Act comes into play. It's a program just for caregivers. And within that OAA reauthorization, we've been talking about extending the life of the Raised Family Caregivers Act Advisory Council so that the government has the time it needs to really understand how we support this critical workforce. And the last thing I would say is innovation. We've been doing work with the Food and Drug Administration to better understand the pathways that caregivers take when they're helping someone out. So for example, a lot of times caregivers may assist somebody with a medical device or may help them administer medication. And yet when we look at the regulations at the FDA and at CMS, we haven't really defined where is that good and where is that bad, despite the fact that there's research that shows that our caregiving relationship may impact my ability to report data. It can impact my ability to assess behavioral health, to understand how much pain someone is in. If your mom is driving you crazy, then you may say she's in a lot more pain than she actually is. And there's no regulations or support or understanding there in a systematic way. So we're thinking about how do caregivers move through these systems? How do we better support them? And also, how do we continue to capture data that moves it ahead? So I would just say I'm so excited to be here. I appreciate all that you are doing day to day. If you'd like recommendations for anything in the French Quarter, just let me know. And I promise not to take any pictures or put anything on Twitter while you're here the rest of the week.
All right. Thank you so much, Grace. Marisa.
Good morning, Lance. Good morning to everyone here in the room. It's really an honor to be part of this panel and to talk a little bit today about how the work that we do at the Aging and Disability Business Institute in partnership with other national organizations, with community-based leaders like you all, as well as our funding partners, including ACL, the John A. Hartford Foundation, the SCAN Foundation, and others, really works to strengthen the Aging and Disability Network. So my job today, I wanted to talk a little bit about progress that we've seen on this front. And the first, sort of way we're gauging this progress in terms of the work that you all are doing every day in contracting with health systems, health plans, physician practices, and other kinds of healthcare organizations is really sort of anecdotal in nature. And just one example, the last couple of days, we at the Aging and Disability Business Institute have run a pre-conference intensive that was focused on the Medicare Advantage supplemental benefits that Lance talked about earlier in his speech. And really what we saw in terms of how much the conversation has changed was that the questions that we're getting right now are not why. Why do we have to do this? Why do we have to partner and contract with healthcare entities? It's how. How do we build the policies and procedures that we need at our agency in order to support this work? How do we choose the IT systems that we need in order to be able to communicate with our partners in the community, as well as with healthcare contracting partners? And how do we go about building the networks that Lance talked about earlier that can support this work in our community, in our state, in our region? So really the conversation has changed here in the room. It's changed in the healthcare sector. Really, we have an acronym right now, SDOH, right? Social Determinants of Health. Once you've gotten an acronym, you've sort of hit, things are becoming much more common in terms of how it works. So we have seen this conversation change, but we also have some numbers to share. Lance had you all kind of raise your hands before in terms of how much this contracting work is happening here in the room among you all. In the work that you do every day. So part of what we do at the Aging and Disability Business Institute is really to look at the extent to which this contracting is occurring between community-based organizations and healthcare entities. So we've done 2 requests for information surveys in 2017 and 2018 to look at where things are and what trends we're seeing in terms of this contracting work. So the first set of data that you see up here on the screen is really the answer to that question of, that we gave to community-based organizations in terms of how many of you are contracting with different kinds of healthcare organizations. And we'll see what those healthcare organizations are in a minute. But the good news is that the trends are all going in the right direction. Between 2017 and 2018, we saw the proportion of community-based organizations that indicated that they had contracts with different kinds of healthcare entities go up from roughly 38% to a little over 41%. That's an 8% increase in just under a year. And concurrently, we saw the trends of those who said, you know what, no, this is not for me. We want to be a blockbuster, as Lance pointed out, saying they weren't contracting and they weren't interested in pursuing contracting, going down. So the lines are all going in the right direction. So in terms of who the most common healthcare partners are, looking at that group that is contracting, you see a lot more contracting within the Medicaid space. And this makes sense, right? Medicaid is most familiar with the kinds of home and community-based services that you all provide every day. So much of the contracting is occurring with Medicaid managed care organizations, with state Medicaid agencies, and on down the list. We did see a really interesting trend in terms of the Medicare Advantage plans. We saw a 60% increase in contracting between community-based organizations and Medicare Advantage plans between 2017 and 2018. What kinds of services are being provided under contract? These are probably going to look all really familiar to you all because it's the work that you're doing every day in your communities. It's care management or care coordination, service coordination, it's care transitions, it's nutrition programs, it's assessment for long-term services and supports eligibility, evidence-based programs, and on down the list. And so the final figure I wanted to share with you all, and I thought this was one of the most exciting things that we learned in terms of the changes between 2017 and 2018, is we asked the community-based organizations that had contracts whether or not these contracts were within a larger community-based network. So for these contracts, were they contracting as part of a network of community-based organizations? And you can see the pretty dramatic increase that we saw between 2017 and 2018. In 2017, under 20% of the community-based organizations that indicated that they had contracts were doing that as part of a community-based network. By 2018, that number had increased by 50%. Over 30% of the community-based organizations who indicated that they were contracting with hospitals or health plans or whatever that healthcare organization was said they were doing that as part of a community-based network. So the lines are all going in the right direction. We have a ways to go, but we're making a lot of progress.
All right, that's encouraging. How about a round of applause for this panel? All right, we're going to jump into some questions. I want to start off with Sandy.
All right.
So Sandy, a question for you. What have you seen as some of the biggest changes and challenges that the Aging Network is facing as far as providing access to services?
Well, Lance, I think it goes back to that comment of both the increasing population that area agencies and Title VI programs are serving and the complexity of that population. The fact that as callers are calling in, they're not just calling for one service. They're calling for multiple services. And the challenge for a lot of the communities is that there may be waiting lists for some of those services. And so they're going to be calling back and trying to get those complex needs met. It becomes more and more difficult. I think the other issue, and I touched on it before, was really, when you're looking at the Aging Network, we're serving multiple generations of older adults. So when we're looking at ways to connect, and I think this is really going to be an issue, it's an issue now and it will be for the future, is how do we do that? How do we do that effectively? And how do we do that with caregivers like Grace, who is trying to reach out to her parents in Austin? How do we use technology and create more technology that will support us in those efforts?
Absolutely. All right, very good. Thank you, Sandy. Again, I agree. It's such a complex and multifaceted issue. The beauty, though, is quite simplistically, we just got to make sure people get help, right? I mean, that's the
Absolutely.
biggest part of this pillar that makes
Absolutely.
sense. So thank you so much. Bob,
Lance.
good old Bob. Bob fans in the house anywhere? Yeah, Bob fans? Yeah? Good old Bob. Assuming we continue to have limited funding for elder justice programs, what programs would you suggest we prioritize for funding?
Well, I'm going to reject the assumption to begin with.
Yeah, okay.
Okay, I'm
you
going to
might.
reject the assumption. We, by this week's end, could have the adoption by the Senate and the signature by the President of a 2-year budget agreement that will provide increase in funding for a whole range of our programs. 2-year budget agreement, no sequestration, no flat funding for a lot of programs. So, as Lance talked about before, talk about a sense of urgency. This is a sense of urgency right now. As advocates, we've got to go in and fight for the additional dollars for adult protective services, for the ombudsman program, get some new money for forensic centers, strengthen the nutrition program so that we're doing more work in the area of safety checks and elder abuse prevention. So I'm not going to make that assumption that we're going to have flat funding for a long time. I think we have an opportunity right now. We're working together. This is a room full of advocates who are very sophisticated, know the appropriation process very well. They're guided very handily by Amy and Autumn in this work. So let's work to get more money for these programs so that we can make a dent in the elder justice situation.
Excellent. All right. I would agree with Bob. I think there's a real resurgence of momentum around this conversation. I know even the White House, I think, has now taken a keen interest in what can we do to help amplify the work that's being done in this particular pillar area. And I might also add for the Elder Justice Coordinating Council, we now have 14 federal agencies participating. So again, an unprecedented number of federal agencies coming to the table to really give some serious conversation to this area. So thanks so much, Bob. Robert, for you, sir, what are the main reasons that state and federal governments should prioritize the direct care workforce in their agendas?
So I think the main reasons that state governments are beginning to prioritize the direct care workforce, one is that they are seeing growing demand, growing numbers of older people, care is becoming increasingly complex. States that are largely rural also struggle with unique challenges given the limited health and social services in those areas. And states are responding to that. I think advocates, which is the second reason, advocates are mobilizing on the ground to create a groundswell that really focuses attention on the home care shortage, on the needs of older people and people with disabilities. But there's two more reasons that I think are really important. One is that when direct care jobs are good, when they provide good career paths, when they effectively integrate home care workers into the full care team and workers work at their top scope of practice, they also improve care and they improve care outcomes. They reduce turnover, they improve job satisfaction, and they reduce ER visits and preventable hospitalization. So there's also a savings that states are recognizing can happen when you strengthen the direct care workforce.
Excellent. Very good, Robert. And I, again, want to echo what you said in your opening remarks. You know, one of the fastest areas of growth for employment is in the healthcare sector. Certainly with the unemployment rate where it's at, lots of opportunity. We just got to make sure we have folks well trained and that they are able to stay in that role and it's a viable vocation for them. So thanks again for the great work you do in New York.
Thank you.
Grace, my suggestion is why don't we FaceTime your mom and you just show everybody that you told. I'm just kidding. Okay.
So get white again.
All right. One challenge, Grace, that we see with our colleagues in patient advocacy communities is the challenge of getting support to diverse populations. So what role do you believe the Aging Network can play in aligning with the work of patient groups such as the American Cancer Society, American Heart Association, and how can aging groups be helpful in advancing the science of medicine through clinical trial recruitment?
So this is a major issue, and because we do work on caregiving across the lifespan, we see more and more companies trying to think about how do we actually get diversity into drug development and into innovative settings. And I think there's a couple of ways that you guys could think about how do we advance the science. Definitely reaching out to organizations that are in your state and looking at clinicaltrials.gov and thinking about how the AAA might be able to play a role in advancing the science and even building partnerships with some of these companies. I also think there are places where you don't have to recreate the wheel, and the disease-specific patient advocacy group may have some really wonderful resources that will help you stretch your resources. So, for example, the American Cancer Society has a cookbook for families so that they can cook together and cook food that's appropriate for somebody who's in chemotherapy and living with cancer. And so those are the types of resources that you could integrate into your existing caregiver services without having to reinvent the wheel. And that may also open up new doors as you work to become the Netflix in your area.
Excellent, very good. Yeah, thanks for calling out those resources, and again, give your mom our best, Grace. We appreciate that. All right, Marisa, we all shed a tear when you left ACL, but we're so glad that you're at n4a doing this critical work. So here's a question for you. What new opportunities are showing promise for CBOs seeking to contract with healthcare entities?
So I talked before a little bit about when we looked at the most common healthcare partners that community-based organization had, that we saw Medicaid organizations at the top of the list. But I think the most exciting opportunities right now for community-based organizations are within the Medicare space, as you talked about before. And there are two really big opportunities that are happening within Medicare. And first, it's exciting that we're even having this conversation about Medicare addressing health-related social needs or social determinants of health in the first place. But the two big opportunities right now are what you referred to before, Lance, the Medicare Advantage supplemental benefits, or the technical term, the special supplemental benefits for the chronically ill, or SSBCI. And those give Medicare Advantage plans the flexibility to target benefits to people who have chronic illnesses and have functional needs that can address social determinants of health and other kinds of community living needs. And the kinds of services that they can offer are going to sound really familiar to you all. You know, they're things like home care, meals, food and produce, transportation for non-medical needs, social needs benefits to address social isolation, and more. So that's the first one. And the second one, which isn't getting as much attention right now as Medicare Advantage supplemental benefits, has to do with some work that's coming out of CMS's Innovation Center, and that has to do with what's called value-based insurance design, or VBID, because we need another acronym to throw in here. So value-based insurance design also is within the Medicare Advantage space, and it gives Medicare Advantage plans, again, that flexibility to address to structure cost sharing, to promote high value services, to do things with insurance design that give them some flexibility to address beneficiaries' individual needs. So it started with 7 states a couple of years ago, and rapid expansion in 2020, Medicare Advantage plans in all 50 states will be able to be part of this VBID demonstration. And what's new with it is that now they can start to target benefits related to social determinants of health. They can offer additional kinds of supplemental benefits that address those needs. They can do that based on disease state, or they can do that on with regard to chronic illness and socioeconomic status. So if someone qualifies for the Medicare Part D extra help or low income subsidy, or is a dual eligible, so they have Medicare and Medicaid, they may qualify for that. So Medicare Advantage plans that are part of VBID also are required to offer wellness and healthcare planning. So there are a lot of opportunities right now for community-based organizations, for the collective leadership that you talked about before, who are here in this room to really help Medicare Advantage plans and other healthcare entities to sort of work through these issues related to social determinants of health and to provide those services that we know older adults, persons with disabilities, and their caregivers need every day.
All right, very good. Thank you, Marisa. And again, I'm so glad you're a big champion of this conversation. Love the new data, the trend lines. That's so encouraging. Okay, so I think I interpreted Autumn's hand signals appropriately, which means what I want to do is just real quickly go back down the line if there's any additional thoughts you have that you might want to quickly share with one actual question, and that, Grace, is for you. So I want to ask you, could you talk a little bit about the role of the private sector colleagues that we have in improving the aging America? And any examples of public-private partnerships that you see are working well. So answer that question if you would when we get to you, but I want to quickly pitch it to Sandy and we'll go down the line if there are any other final comments you have.
Sure.
Oh, no, you go first. and then we'll go. Yeah.
Oh, me first.
Yeah,
Oh,
yeah,
sorry.
yeah.
I wasn't following instructions well here. In saying that, I think as we look at as we look into the future, if I had a crystal ball, what I think that this network needs, Lance, as far as access and connection to services that we offer, are really four things. One is research. And that is an element that's been discussed as part of the reauthorization of the Older Americans Act. We need research to be able to show our ROI. And we know we do a great job, but we need to have research, and we need to be able to give ACL, we want to give you money to do this level of research so that we can prove the value proposition of working with this incredible network. I think the other issue is looking at ways to help the network through IT systems to collect data to be able to show, again, that return on investment. And I think the other issue that I would put out is, and n4a is working on and working with you on, is looking at developing core competencies and standards for the network. So again, we can show the broader healthcare network and others the value and the quality of the services that this network delivers. And finally, I think the other thing that collectively we all need to do together is develop a communication plan. So that we can message this as a network that has huge value to older adults, to people with disabilities, caregivers, and it has value with partnering with this network with healthcare and others.
Awesome. Thank you, Sandy. You are awesome. We're blessed having our network as a leader. Bob, any final thoughts?
One or two. Elder justice is never going to be achieved until we prevent elder abuse, pure and simple. Okay? It's not an innovative issue. It's a basic fundamental issue. And we have got to be more concerned as a country about this issue. We must have a stronger political imperative attached to our work. This must be a bread and butter issue that affects congressional districts and Senate offices and the administration. We're making good progress. There's no question that progress is being made. But money still drives the ship. Okay? And we need to have additional funding for programs like the Social Services Block Grant and the Older Americans Act. And we need to have things like forensic centers, so when an older person goes to an emergency room and has a bruise, they're not assuming it was a fall. It could be physical abuse. So we have many things that we still have to do, but this network, this room of people, many of whom I know are active in this space, have got to step up the game even a little bit more, because those of you who have direct contact with older people become critically important in the elder abuse prevention area. So let's continue to work together.
Absolutely. Very grateful. I know, Bob, you and I have talked about making this a personal issue. This needs to be a household by household issue if we want to really eradicate elder abuse, then community by community, state by state. Robert.
The final comment I would make is that, at PHI, we often get questions from people all around the country about how to strengthen the direct care workforce. They come from journalists, they come from policymakers, from community advocates, researchers, the entire spectrum. And when you ask people what motivated you to begin doing this work, they often open up with a very personal story about a parent, about a loved one, sometimes about themselves. I think it speaks to two issues that I think are really important in our work. One is that this is an issue that is widely felt, but it's also in many ways in its earliest of stages in terms of governmental reform. So I think we have an opportunity to really tip that point and create that kind of progress. But the second is to remember that a good tenet of organizing, of communications, of interpersonal effectiveness is about recognizing where people are at and understanding their stories. And I think it's really powerful that some of the best news stories, some of the most innovative policy and practice reforms that we're seeing are because individuals said something is wrong in my life, something is wrong in the system that shrouds my life, and I can play a role. So I would encourage all of us to think about that.
Wonderful. Thank you, Robert. Appreciate the work you're doing at PHI. So, Grace, you've got closing comments as well and your question on the private sector work.
Yeah, I mean, so I would say we do a lot of work with corporations as well as not-for-profit organizations and federal agencies. And I think many private sector parties are interested in how we improve our lives as we age, and there's an opportunity there for people who are community-based organizations, who are working at the grassroots level and the state level to really work closely with what a provider is doing, what a tech innovator is doing. One of the most exciting partnerships I've seen previously is Lyft, which is like Uber, if you're not familiar with it. It's sort of funny. It's like don't get in a stranger's car, talk to people on the internet, and then you just show up in a stranger's car that you just met on the internet. But, but what I would say is that, to Robert's point about meet people where they are, right? People are already comfortable with programs like Skype, with Lyft, with Uber. And so even rather than recreate the wheel and create an all new thing, think about where you can leverage that desire for corporate social responsibility to better support the aging network. The other thing I would just say, sort of as a closing thought, is remember that it's not a one-size-fits-all, right? I've met people who are in their 50s caring for adults with Down syndrome. We've met people of all ages who are struggling with rare diseases. Mental health is another big area where caregivers are often unsupported. So be thinking about the heterogeneity of the populations that you serve, and that it's not just the common things that we think about like falls prevention or dementia or frailty, but it's many different types of diseases that are a normal part of our everyday life. You guys are the experts, and you have the opportunity to really make a difference for a lot of people through being creative in your partnerships, working more closely with health insurance and providers, and just thinking about how you're moving through these systems of care.
Wonderful. Thank you, Grace. Again, we all know the power in having conversations around supporting caregivers. Again, a key pillar, and thanks for the work that you do. Marisa.
Okay. So these are really exciting but challenging times when it comes to the road that lies ahead with regard to contracting between area agencies on aging and other community-based organizations and healthcare organizations. And I just wanted to really quickly talk a little bit about another lesson that came out of this for all of us from our Medicare Advantage supplemental benefits pre-conference intensive. And one of the things that we heard from participants in that was that, everyone has questions about how these new benefits are going to roll out. I think the plans have questions, the advocacy organizations that represent plans, that we have questions, you all had questions there in the audience. We are all learning our way through this. But now is our time to really lead. And this is an area where, just like our logo says, the work that you do as AAAs, we have the answers on aging. And we can help to lead the way when it comes to how these benefits roll out and what they look like for the people we serve. So it's exciting and challenging all at the same time.
It is exciting. So again, we want to thank all of you for your attention. And again, as a reminder, the 5 pillars we've laid out for ACL, they're your pillars. They're our network's pillars. It offers us a way to have a common conversation. Again, very few people, even go to Capitol Hill, very few people can't relate to, if not one, all of these pillars. So again, thanks to this panel. One more round of applause for them. And Sandy, I think it's yours. Yeah. Thank you.
Can we go back down?
Yeah.
We'll go back down.
That way. Wow. It is, I want to echo Lance's thanks to the panel. I have the privilege of working with all of these folks on a regular basis in Washington, D.C., and I'm glad that you got to hear directly from them about these issues and about this important work. This morning, we've heard from our speakers about the need for innovation and the importance of serving those most in need, and you've seen evidence of their passion for older adults and caregivers. And now, we turn to the presentation of innovation within this aging network, the presentation of the Innovation and Achievement Awards winners. All of the attributes and many more are exemplified by this year's winners. The Aging Innovations and Achievement Award program is N4A's most prestigious recognition of programs and services provided by our members. It's valuable to the aging network for both recognition and of these local initiatives and identification of replicable best practices. We're hoping you steal these really good ideas. This awards program acknowledges successful aging services with Aging Achievement Awards and pays tribute to the most innovative efforts with the Innovation Awards. You received highlights of these programs in the AIA Best Practices publication that was in your conference bag. And I'm sure that you'll agree that all of these award-winning programs are a testament to the creativity, the strategic thinking, and the opportunity-seizing work of our Aging Network. Please join me in thanking our AIA sponsor, WellCare Health Plans, for supporting this year's awards program for the 3rd year in a row. Yay! They, like n4a, work to help older adults live with maximum health and independence and value the gap-filling and innovative programs that you're running back home. And help me welcome to the stage Mark Henry, WellCare's Director of Long-Term Care and Home and Community-Based Contracting, who would like to say a few words. Mark?
Thanks, Sandy, and good morning, everyone. WellCare is thrilled to be a supporter of the n4a, our local AAAs, and the n4a Aging and Innovation Achievement Awards. WellCare is a managed care organization that supports over 6.3 million members nationwide, many of which are seniors. WellCare understands the importance of innovation, particularly when supporting aging adults, people with disabilities, and their caregivers. What is innovation, and what does it mean to be innovative? And why is it important? George Bernard Shaw once said, the reasonable man adapts himself to the world. The unreasonable one persists in trying to adapt the world to himself. Therefore, all progress depends on the unreasonable man. Think about that. I never did want to be unreasonable, but now I do. So innovation is about creative and original ideas, the ability to take those ideas and put them into practice, adapting, evolving, staying relevant, like a Netflix. A great idea executed brilliantly addresses a need, brings value to their customers, their consumers, and their stakeholders, and looks at data to support the success of those innovations, the ROI that Sandy was talking about. Thought leadership in an industry leads to best practice that changes lives. So why is it important in healthcare and the aging? Well, it leads to more efficient and proactive care. It leads to healthier population. It leads to higher quality of life for individuals and their caregivers. Can lengthen and improve lifespan of both individuals as well as the outstanding organizations who support them. And ultimately, it leads to needed support for the unique needs of other older adults, people with disabilities, and caregivers to allow them to remain at home in their communities for as long as possible. At WellCare, we know that innovation is the foundation of some of our best and most successful practices in healthcare. Our Community Connections model was founded on innovation. As a result, we have connected thousands of individuals to needed social services in their community and have partnered with more than 200,000 organizations to not only support individuals from the aging population, but to support the social safety net providers who are supporting them and the safety net itself. WellCare tracks the referrals and uses data to identify gaps in the social service network to create proactive solutions and partnerships to help transform the social service delivery system. We believe that our local area agencies on aging and other community partners in the aging space are a critical component in the healthcare system. Through our Community Connections model, our advocacy and community-based programs department, as well as our long-term support services network development team, we are spearheading unique partnerships with our AAAs and others in ways that haven't been done before. So innovation to move the dial on quality of care for the aging population and social determinants of health is, in order to keep moving that dial, we've got to address healthcare, social determinants of health, and quality of life for the aging population. It is critical to foster an environment that rewards and encourages our own just within our own organizations, but externally with our partners. We could not be more proud or excited to support N4A, our long-time and dedicated partner, and their Innovation and Achievement Awards. We congratulate and thank all the nominees, all of whom we had the honor of meeting at yesterday's luncheon. And every program was truly incredible. And we greatly appreciate their tireless commitment to helping people live healthier, more fulfilling lives through these innovative programs. Thank you so much.
Thank you, Mark. We are so pleased to continue our partnership with WellCare to showcase aging innovations. And now I'd like to invite back to the stage a dynamic duo, ACL Administrator Lance Robertson and N4A President Deb Stonewalls, to help with the presentation of the awards. This year, we're going to be recognizing 32 Achievement Award winners and 16 Innovation Award winners. Awards were presented, as Mark said, yesterday at a very special luncheon. And right now, I'd like to recognize the Achievement Award winners. All 32 of you, please stand and be recognized by your colleagues. And now we'd like to salute the Innovation Award winners. If you would please stand. All right, Innovation Award winners. As is our tradition, the highest scoring innovation programs will receive monetary awards as well, thanks to the support of WellCare. And this is always one of the biggest reveals of the N4A conference, as the 16 innovation winners don't know if they will be the one of the 3 agencies that will take home a big check. But I'm going to reveal it now. All right, are you ready? Okay, the third place winner of $1,000 is in the health aging category is Juniper, Your Health, Your Community by the Metropolitan Area Agency on Aging in Arden Hills, Minnesota. Come up to the stage and get your check. It's a big check. Good luck getting it on the plane, though. Yay! Congratulations. All right, are you ready? The second place winner of $1,500 is in the healthy aging category as well, and that is Fanfare by the KIPTA Area Agency on Aging and Independent Living in Louisville, Kentucky. My KIPTA friends, come forward. Yay, congratulations. All right, are you ready for the big reveal? All right, here we go. The first place winner of $2,500 is in the nutrition category, and it is Mobile Farmers Market from the Central Plains Area Agency on Aging in Wichita, Kansas. It's so fun to surprise people, you know? Congratulations to all of this year's award winners. Another round of applause for them all. And for everyone else, we hope that you will nominate both your Achievement Awards and your innovative programs when we come out with the awards programs next February. And just, you may be getting one of these big, huge checks on the stage, so it's worth the time to fill out that nominations process. Well, now we've had a lot of discussion this morning about public policy, and Bob talked about the need to really advocate hard for funding. Lance talked about the Older Americans Act, so I now have the privilege of bringing to the stage N4A's incredible Chief of Public Policy and External Affairs, Amy Gotwals, who are going to give you a big, major public policy pitch. Amy?
Thanks, Sandy. Good morning, advocates. As Sandy said, I have the distinct pleasure of working on N4A's policy efforts, which are also led by our wonderful Senior Director of Public Policy and Advocacy, Autumn Campbell. I hope you will agree with us that advancing sound federal aging policy, I talk faster than that, y'all. Sound federal aging policy is critical to our shared mission to support older adults and caregivers. It's the major reason that N4A is located in Washington, D.C., to ensure that we have access to your lawmakers, are at the table for national policy conversations, and work closely with key administration officials on implementing said policies. From this stage last year, we were urging you all to fill out a survey on the reauthorization of the Older Americans Act. Your input was essential in developing our OAA reauthorization recommendations, which were then brought to life by the Public Policy and Grassroots Committee of the N4A Board, then published in March. And it was published in the nick of time, I might add, as our annual aging policy briefing wasn't even over yet before we were called up by the Senate Committee of Jurisdiction to present our recommendations. It's been a whirlwind ever since, with countless Hill visits, emails, and negotiations. Negotiations with Hill staff, but also with other national aging organizations, including a few of the ones who are just represented on the stage. Because you all are involved in just about every aspect of aging and the OAA at the community level, N4A works ferociously to advocate, to protect your interests, and to ensure that our members' perspectives are fully taken into consideration. In fact, two N4A members, Larry Gross of Portland, Maine, and Lee Gerard of Multnomah County, Oregon, both came to DC, yes, in May, and testified about the OAA to Senate and House committees, bringing to life this law and what it does so well for older adults and caregivers. As you know, the Senate has produced a bipartisan discussion draft back in June, which is really a bill that they're not ready to introduce, that they share to get stakeholder feedback and buy-in. Although we've been already, at that point, working very closely with all of the Senate's reauthorization leaders, there's always more to say. So our response to that draft clocked in at 11 pages. As I said, you all do a lot, so we do too. We're undergoing a similar process in the House. It started later, but they're going to soon catch up to the Senate. And for the past 2 months, it's a rare day when the lead staff for the House committee aren't reaching out to Autumn to run something by N4A. We've stopped a number of worrisome or poorly executed ideas, prevented a few unfunded mandates, and helped improve others' ideas to ensure that the result means continued flexibility, increased investment, and changes, even if modest, that will help, not hurt, this amazing act. And we've done this all with the Policy Committee on speed dial to ensure we bring a AAA director's perspective to all of our conversations on the Hill. So I know I sound a little braggy right now, and I will admit I'm very proud of how hard we have lobbied Congress this spring and the progress we've made. But our advocacy in DC is only as strong as yours is in your communities. So it's your visibility, your expertise, and your reputation at home that open all these doors for us in DC. And we never forget it. Now, every good advocate knows to have an ask in every meeting, and I have one for you today. We need you to put a lot of advocacy in your August. Although the work on reauthorization has largely been done inside the Beltway so far this year, and although Congress's ambitious timeline for reauthorization kept things humming for the past 5 months, it's now all at risk of stalling out. For those of you who have been around a few reauthorizations, you won't be surprised to learn that the nuances of the Older Americans Act funding formula have once again bogged down a reauthorization process. Senate negotiators are at an impasse, so the committee hasn't even begun to debate the feedback that we and many others sent them last month, and they won't until the funding formula issue is resolved. Unfortunately, n4a alone can't fix this issue because it's one of the rare reauthorization conversations that n4a stays out of, given the varying effect on our member agencies in different states. To ensure that we don't lose the opportunity to get reauthorization done in a bipartisan, non-controversial fashion, we have to turn up the heat. We need your help and advocacy to get back the momentum the Senate had just a few weeks ago and push this through this summer and fall. Now, Congress has left DC right now and won't be back till September, but that's ideal for advocacy because they're all home and tuning into their constituents. If our network collectively pushes hard in August, lights fires under members of Congress who aren't as aware of OAA as they should be, and keeps up the pressure to get this done by the time the act expires at the end of September, then we will achieve this. Remember, lawmakers' staff are still in DC in August, and they can work behind the scenes to prep bills and get deals. But only you can create the pressure on your senators and representatives to make this a priority. To help with this advocacy, we've created our most extensive advocacy toolkit ever, with everything you need to take action in August and beyond. If you already sent a letter back in the spring, follow up with another letter asking for a status update. Find out what public events your members of Congress will be at in August, whether official town halls or not, and go. Or send that persuasive advisory board member of yours who loves policy. You all have one. And the message is simple. It's get the OAA reauthorized this year. But it can't just be agency leaders who weigh in. You need to activate all your stakeholders. That's why our toolkit has more consumer-focused advocacy alert that's just awaiting your logo at the top. Older Americans Act is not controversial, so this should be an easy ask of your providers, partners, allies, and even clients. To get the widest reach possible, the toolkit has social media messages and even images for your agency to push out, and much more, which you can find at our toolkit at n4a.org/OAA. And remember, if you hit a roadblock or have a question, your n4a policy team stands ready to help, so reach out to Autumn and I. You know, we've been doing increased amount of policy updates via conference calls and webinars this spring. So if you want us to give an OAA or broader legislative update to your board, just holler, and we'll do our best to accommodate that. But speaking of hollering, we do need to get loud. Please make it a priority to step up your advocacy this summer. If we don't ensure that Congress does right by the millions of people served by the Older Americans Act, who else will? So let's get loud, okay?
All right, Amy and Autumn, we have two incredible representatives of this organization working on public policy issues. And as Amy said, we are here to serve you. So if you want updates about what's going on in Washington, if you need support on your advocacy around reauthorization, just call us. We're here to help you. I want you to know that everyone at n4a stands ready to support you in your efforts. We take it seriously that we are your membership organization. So in addition to the policy staff, you have all of the n4a staff who are here in this room are here to help you. And I hope that you will take advantage of that. And I hope that you will get loud. All right, it's now time to break and to go into the trade show with our wonderful exhibitors. Workshops begin at 10:30. Have a